Hi, my name is Heather Lieberman. My student ID number is 3309588. This is my final video for my Clinical Pathology 1 class, class number 2223-33430. So let's get started with some chemistry. Alright, Heather Lieberman here. Today I'm going to be performing a blood chemistry panel in-house. So what we're going to do is we're going to be running this pre-surgical panel. It does have a couple good kidney and liver values in there, which is important for a surgical patient since the anesthesia is metabolized through those two organs. I have spun down our blood that we're going to use today. It is a little hemolytic, just noting that off the bat. So I'm going to start setting up here. I'm going to place this in my sample position. I have warmed my cartridges up to room temperature, and I've kept them protected from light until I was ready to run the sample. I also have my patient set up here. We do order that through our computer system, and it is transferred over to here. I'm going to set up my slides, and then the one last thing is that I do need a tip. So we have these little tips. I'm going to pop that right in there, and then it is ready to go. So I will hit start, and that'll get started, and we will be back with results. Okay, so we got our results back from our panel here. This was an older sample of blood, so his glucose came back significantly pretty low there. That could have been just from it sitting out over time. The total protein did come back a little high, so it could mean there's some dehydration going on, and otherwise it could mean that we need to just do a little more investigation on why that level is that high. Otherwise, everything was within normal limits. So from here, I would just give this to my doctor for some interpretation. Hi, Heather Lieberman here. My student ID number is 3309588. In this portion of my video, I'm going to be doing a serology test. For that, I'm going to be doing a CPL or canine pancreatic lipase test. And I have it on my patient bell here. I do want to note that the serum that we have collected from here is a little icteric in color. So we're going to get this started here. So it comes all nicely wrapped in this foil here. We want to keep it protected from light as much as possible. I'm going to open that up. I have my little directions here for this test. What I want to do is I want to add 3 drops of my sample and 4 drops of my conjugate into there. So I'm going to start with my sample. They provide me with a nice little pipette. I'm going to drop my 3 drops in. Katie, you want to come a little closer, I guess. So 1, 2, 3. Squeeze the rest of my sample. And then I'm going to do 4 drops of this. So I'm going to turn it over completely. 1, 2, 3, 4. Okay. So I'm going to invert this, not shaking too roughly here. And it says about 3 to 5 times that I want to do that. So once I have my sample mixed together, I'm going to pour it into the well here. Once it comes across down into the little one right here, then that's when I'm going to want to push this down completely. So again, I'm going to just dump my sample into the well. And I'll see it kind of coming across here. Where those spots are where I'm going to get my test results based on things. So just coming across. Slowly. It's not really moving anymore. Close. Mm-hmm.
And then
It's moving slowly.
It is moving slowly.
probably. Okay. Yeah.
All right, so I'm going to go ahead. It is starting to come at the very tippy top of my well right there. Press that down completely. And for this test, I believe we wait 10 minutes, but I will verify. Yep, 10 minutes, so we'll be back in 10. All right, awesome. So we're back after our 10-minute wait for the test to run. So if you want to come and zoom here on our results. So this side over here is our reference spot, and this is our sample spot on this side. And I'll see if I can bring it even a little closer here. So this side again is our sample spot, which is darker than the reference spot, which means that it is an abnormal result. So basically from there I would just let the doctor know that we did have abnormal reading on our test here. And that's it for this CPL test. Hi, Heather Lieberman here, and in my final video I'm going to be demonstrating a direct heartworm smear. So in this I'm going to be looking for microfilaria, specifically Dirofilaria immitis, which is heartworm. What I do want to kind of keep caution for when I'm looking for that, if I were to see any microfilaria, is differentiating that between acanthocheilonemia. So the difference that I would be able to tell between the two is that heartworm, or the Dirofilaria, has a tapered head, where the acanthocheilonemia has a blunt head. So some things to keep in mind while I'm actually looking at the slide. So let's start with prepping it. I'm going to start with a clean microscope slide here. I have some anticoagulated blood that I collected on Mr. Vader. I'm just going to invert it a little bit to mix my sample. And I'm going to put one drop onto the slide. Okay. And then I'm going to take a cover slip and just kind of bring that onto there. Let it cover my sample. And then we're going to come over to the microscope, okay? So I do want to check the entire sample on here. I want to go through the entire thing to make sure that I'm not missing any if there are any there. So we start on low power. There we are. And then I'm going to get my sample a little more centered here. So what I want to do is I do want to kind of look through my sample. If there were to be any microfilaria, you would see them swarming around through the red blood cells that are present. So I'm going to move down. And then I'm going to move over, go back up. Just do a quick once over my sample on low power. Okay. And then I'm going to switch on over to high power. You can kind of stop here in the middle to get focused again. Beautiful. And then move through. Okay, so then I would again just go through my entire sample looking for any microfilaria. And I'll do a couple runs through here, adjusting my fine adjustment knob as needed to stay in focus. Okay. Now move over, go back down. And then I would run through this until I completed looking at the entire sample. Okay, so that is my demonstration of a microfilaria direct smear.